All right, this is Dr. Fraley. Welcome to part two of our third case in this series. So, again, this is a case of a patient with an irregular heartbeat um, and other things, peripheral circulation issues, knee pain, and chronic high blood pressure. So, hopefully, after last week, you kind of had a chance to think through some of the differential diagnoses and the underlying physiology behind this issue. So, let's do a quick little review of this case. So, patient presents chief complaint of a regular heartbeat. He is under the care of a cardiovascular medical doctor. He's on multiple medications to control both the irregular heartbeat and high blood pressure. He has suffered severe vascular compromise in his legs, which his cardiologist admits is to some degree due to the medication that he's on. So the medication is lowering his blood pressure a lot, and that's causing some of the valves in his legs to leak. And to this point, he's had 13 surgeries to close veins in the lower extremities to try to improve circulation. He's concerned the medication being used to maintain his blood pressure is causing other side effects, and would like to do something naturally to help the situation. His history also reveals a viral based hearing loss that started about 2 years ago, and he also complains of right knee pain. So let's look at it again. This was sort of our differential diagnosis. Now, I didn't put in the differential diagnosis, the viral based hearing loss, because typically that type of hearing loss, if it truly was infection based, represents damage to the nerve cells, which are really hard to get back. And so that might be something I would address with this patient at a later time. But dealing with circulation, particularly for brain stuff, when you know that's an issue, in my opinion, takes precedence. You got to have a fuel supply to the brain before you can start doing rehab to it. So, this is how I would write up the differential diagnosis. It may not be how you would do it, and that's fine. But again, I can only share my thoughts and sort of what I do, and hopefully we can learn from each other. So, here's kind of what I did. So, this is the exam processes I went through. In my office, I always do a structural portion, a nutritional portion, and a neurological portion. And so I won't bore you with all the x rays, but we did x rays on the patient, on his spine as well as his knee. The patient had an anatomically short right leg as well as right knee pain and a pretty substantially dropped right sacral base angle. So that leads to a right lumbar scoliosis and a lot of degenerative disc disease in that spine. So um, there's a lot of disc compression through the lumbar spine. Now, what was interesting is there was a very large abdominal aortic aneurysm. So typically, you don't see arteries on X-ray. That's not why you shoot that. But when we shot his lateral lumbar view, he measured over, it was almost a 6.5 centimeter abdominal aneurysm. So just so you know, not that it's really so much of a nutritional thing, but anything over 4 centimeters on X-ray is considered a triple A, an abdominal aortic aneurysm, and really should be evaluated by a cardiovascular surgeon because if that blood vessel ruptures, you'll bleed out in a matter of seconds. It's just a ton of blood going through that area. So now he's already under a cardiovascular doctor's care, um, but I'm going to bring this up to him, or I did bring this up to him when we did his report of findings, because sometimes this may have been missed. And again, if the blood vessels are compromised sufficiently, this is really a death sentence. All he really has to do is, you know, fall and on his tummy or do something that presses on that aneurysm, let it rupture, and he's done. It's also important if you do manual therapy. I know a lot of people taking this course do. Like this is a person you really don't want on their tummy pushing down on their stomach so much because the last thing you'd want is somebody to die on your table. So, anyways, um, patient has a severe anterior head carriage. So he's got a way head forward posture, and his head's on really crooked. He has a major left head tilt. Now, part of the reason he has that is because his legs have been hurting him so bad. He's been sleeping upright in a chair for more than a year. So that's just not great for a lot of things. We also did a 3D model scan of his feet. So very often the knee is secondary to other issues, and foot issues are very common. And he had lost almost all the arches in both of his feet. So that's something from a structural view I would want to evaluate. So this patient measured up at 6 feet 1 inches tall, weighed 287 pounds, so fairly overweight. His heart sounds, when we listen to his heart, were definitely irregular and weak. And again, weak heart sounds with this kind of patient really makes me question how much structural change the person's heart has undergone. A lot of cardiomyopathy, a lot of damage, or the heart is being suppressed due to some of the medication. They're trying really hard to keep his blood pressure down and so forth. And now that I've seen that abdominal aneurysm, I kind of question that as a potential reason why. Maybe they really are worried about a hemorrhage down there at that abdominal aorta, and they're trying to keep him alive. So something to consider. We did a live blood cell analysis, and we showed some membrane degradation of the red blood cells, and the dry blood cells, the dry blood cells showed high amounts of protein puddles. I'll show you that. So again, what that means is his antioxidant status is really poor. Methyl testing shows switch to viruses and foods, particularly grains and sugars. Okay. So neurologically, he has anisocoria. So his right pupil is significantly larger than his left pupil. Anisocoria is a classic sign of brain trauma. This could be a stroke, and that's sort of my suspicion for this patient. So basically, by looking at this, I have an inkling that his circulation's been compromised enough that he is having small strokes, um, and that's going to affect a lot of potential things in the future for him. His overall balance scores were approximately 25 centimeters with a head in neutral position. So like I say, normal is probably 10 to 12, so his balance is definitely off. And then that gets much worse when his head goes into certain positions, which tells me the vestibular canals are involved. And remember, from a neurological point of view, there's a huge correlation between the vestibular system and digestion and balance and blood pressure. All of those are connected. So his pseudomotor testing showed clear signs of neuropathy. So we know the nerves in his arms and legs are not healthy, although not as bad as I would have expected, which makes me think it's more of a circulation issue than a nerve issue. So when we did the autonomic nervous system testing, so we laid him down, hooked up an EKG, put on pulse oxes and blood pressure cuffs on all of the extremities, and then had him do some things to stress him out. So grip, bear down, tilt him up on the table, and so forth. On my machine, his heart was too irregular to get normal measurements. So there was a pretty significant irregular heartbeat. Based on the EKG, at least 15% of the patient's heartbeat was irregular. And that's with quite a bit of different medications that this guy's on. So he's on quite a laundry list of meds. And despite all that, his heartbeat is not great. And that's something important to consider because you have to at some point wonder, is the medication doing its job? If he's on 9 medications for addressing his blood pressure and his heart rate, and he still has 15, 20, 25, 30% of his heartbeats are irregular, is it really working for him? And that's something to consider. His reflexes were hypo, and again, hyporeflexive whole body is indicative of low thyroid. And so one of our differential was thyroid issues. And so we kind of looked at that. We did an ultrasound of his thyroid, and the thyroid looked healthy. And so that makes me suspicion that if his thyroid is low, and his lab work did not show that, but if his thyroid is low, it's probably from high adrenaline, and that's something to be concerned about. The patient showed decreased sense of vibration on the right V2 and 3 and the right L4 dermatome. So He only had decrease in the right L4 dermatome. So that's the dermatome, that's the nerve from the low back down into the leg. So we know from other testing that the nerves on both sides are compromised, and one of those forms of compromise could be from spinal arthritis, disc problems, that kind of stuff. But because the nerves on both sides are unhealthy, it makes me think it's more, again, either neurological or circulation, and probably circulation in his case. The right V2 and 3 dermatomes, that's in the face. And we remember from our history, he said he had that viral inner ear infection. And so I kind of believe that may be one of the side effects of that the nerves, cranial nerve 7 and 8 that kind of go to that part of the head were compromised due to that virus. So here's one of the ultrasounds that we had done on him. And if you can kind of see where the little arrow is pointing up there, there's plaquing. So this is normal plaquing. Everybody's going to have plaquing like this a little bit. This is a little more than normal, but you can definitely see. But then you have this plaquing. And this is the plaquing that I don't want to see. So when I see plaquing like this, where you have what looks like little nodules, um, that's, in my opinion, and the general opinion, is much more dangerous because um, pressure can knock those little nodules off, and they can go directly up. This is the carotid artery, directly up into the brain and cause strokes. And we now have evidence from multiple sides that this is already happening to him. So again, this is a person that is at very high risk for a stroke or a um, pulmonary embolism or a heart attack due to this type of plaquing in his system. So this was the summary of the EKG we did while he was doing the autonomic nervous system testing, and you can just kind of see, he was 85% normal, but 9% were irregular, and then 5.5% were extra systolic. So he has irregular heartbeats, and he has extra atrial heartbeats. So basically, his entire heart is not pumping well. And so, again, this would be something that would be a concern as to why. Is this truly issues with the heart? In other words, has the heart undergone enough cardiomegaly? Is there enough changes to the structure of the heart where the conduction system is now structurally compromised? Or is this various medications and how they're affecting that beat? Again, he's on a bunch of them, so sometimes there's interactions that are not ideal. Or are there such sufficient blockages through the coronary arteries that the nerves are firing erratically because they're not getting a fuel supply? All of these are significant questions that I would like answered. So here's a picture of his blood. So again, you can see some signs of stacking, but not as much as I would expect. But again, this guy is on multiple blood thinners. He's doing some things to really sort of suppress some processes that would be involved here. If you can kind of see, and this picture doesn't do it as justice as much as I would like, but a lot of these cell membranes are angled. They're compromised, and those little angles are almost always toxicity based. Sometimes infection, but usually toxicity based. So definitely has signs of toxic issues. When you look at the dry blood, if you can kind of see, there's a lot of white in this person's dry blood. And again, that's basically the blood version of rusting. So oxygen is exposed, is given directly to the blood cells. If the blood cells themselves have enough antioxidants in them, they're okay. But if not, then the iron in the blood, the other chemicals in the blood will react to the oxygen and basically go through a similar process of rusting. And that will rupture the cells and leave just sort of white or blank areas in our samples. So again, this person is not getting sufficient antioxidants to handle oxygen well. So here was a summary of the pseudomotor autonomic system. So this was basically what I would like is for all these little blue dots to be in the green. They're not, but they're not as far in the red as I really would have expected given the amount of compromise this guy has, um, which tells me it's probably more circulation than nerve health as an underlying cause of this person's issues. Okay, so here we are. What should you do? So you've seen diagnostics, and remember, before we've even seen this patient, he's had multiple EKGs, he's had calcium scores for coronary arteries, he's had chest x-rays, he's had multiple things of blood work, he's had multiple vascular surgeries, he's had cardiac ultrasounds. So medically, he's kind of run the gamut as far as the testing. And his cardiologist is relatively happy with all of those numbers, good, bad, or ugly. So, with that in mind, and the test that we kind of did here, are the other diagnostic test you would insist on for this patient at this time? Is there anything that you'd be like, I got to see this before I work on you? The second part, give me 5 things you would do now for treatment. This person's in your office, he's ready to get started, he wants to do something. Where are you going to start? Give me 5 things. And then I want you to think of 10 other things that you'd like to do for this patient if they're willing. So if time and money weren't an issue and you had all the toys you could want in your office, what else would you do? What else would you think would be beneficial for him? All right, and I'll talk to you next week.